You know, I love walking into creation and seeing the undulation of the landscape. And you know, pharmacy practice, it's no different. You and I have seen the ups and downs for sure of pharmacy practice. And now there is this push towards this one word, and that's quality. But you know, you and I as community pharmacists can make an incredible difference in the lives of our patients. Whereas there are entities in the larger cities that have great programs to be able to help patients improve their outcomes, specifically with chronic disease. You know, they cannot always reach the rural areas, whereas you and I many times are in the smallest arteries of America, and there may not always be a red light, but there's almost always a community pharmacy. And so you can make an incredible impact in the lives of your patients. You know, at the end of this, I want you to know, I want you to feel how you can make an impact not only with your patients living with chronic disease such as diabetes, hypertension, and others, but I want you to also know that you can not just survive, but you can thrive in today's landscape. So in this series, we want you to have a guideline for practicing in today's landscape. We're calling this the clinical community pharmacist. Now, we're all clinical in nature. It's more of a mindset. And so therefore, there are 4 specific points of the clinical community pharmacist. The first point is that they are chronic care oriented. They are focusing on chronic disease states such as diabetes, hypertension, and more. But then the second piece is that they're also an integral member of the healthcare team. We'll talk about how they are interacting with other healthcare professionals such as hospitals, physicians, and other. The third piece is that they are utilizing creative technology. If we're going to be able to compete in today's landscape, we have to be able to use the right tool at the right time for the right patient. And the last piece is this, is that we would utilize creative marketing in all that we do. And so therefore we would not say we've been around for 50 years and we offer great customer service, but that we would say, if you have diabetes, if you have high blood pressure, we speak your language and we want to connect with you in a very real way. Those are the 4 points of the clinical community pharmacist. You know, pharmacists have now a vested interest in the outcomes of their patients. You know, for years, we always would take a prescription refill and we would thank them for coming in and we would give them that prescription, we would counsel them as needed, and then ultimately we would say, I'll see you if and when you ever decide to come back and pick up your prescription again. Well, you see, that time has changed, whereas now we want to say, here's your prescription for your metformin, for your lisinopril, for whatever it may be. And now we are going to walk through this together, arm in arm. You and I are going to partner together as you are taking this medicine, because we want to make sure that you don't have any side effects that would keep you from taking this medicine. There may be other barriers that may prevent you from being able to take this medicine. And again, it's not just did you take it, but we're looking for outcomes, not just did you take the medicine, but let's take a look at your A1C. Let's take a look at your blood pressure. And so when you come into the pharmacy from now on, I'm gonna ask you, how's your blood sugar been in the morning? I may ask you, how's your blood pressure been? I may utilize creative technology for you to be able to report that back to me, such as a blood pressure monitoring system and the like. And so therefore, we as community pharmacists are dispensing that medicine, but we are also in that dispensing, carrying with that ourselves and an easy way for them to be able to connect back with us so that we can monitor for adherence as well as for positive outcomes. We know that when you get involved as a pharmacist in the care of your patients, outcomes improve. If we look at this equation for success, for example, we see where pharmacist intervention, connecting with patients, when we add that to chronic care patients or prevention of chronic disease, such as pre-diabetes, we end up having lower overall healthcare costs across all boards, improved outcomes, less chronic disease, as well as for you, a more profitable pharmacy business. There are 3 specific ways that you can become more chronic care oriented as a clinical community pharmacist. The first is medication adherence. This must become part of the DNA of your pharmacy, and the majority of your patients, if not all of your patients living with a chronic disease such as heart failure, should be on a medication adherence program. Now, whether that includes a medication synchronization type of program, whether that includes some sort of callbacks to your patients or other, you just need to be making sure that you are helping to hold your patients adherent to their medicine. But not only that, that must be coupled with 2 additional things, and that is, secondly, would be education. You need to make sure that you are educating your patients as they're leaving the pharmacy. They need to make sure that they know the specific vitals that they need to be monitoring, such as blood sugar, blood pressure. What should those normal values be? Also, we want to make sure that we answer the primary question within diabetes and most major chronic diseases, which is, what do I eat? How do I exercise? How much should I exercise? Or how many calories or how many carbohydrates should I eat? That is all for you, the pharmacist. You can play the primary role in educating your patients along with the team to make sure that we can ensure their success. And then finally, monitoring. This is vital for you to be able to ensure the effectiveness of the drug. And not only that, but we want to make sure that we're not seeing any side effects, as well as helping to monitor the first prescription that's ever written for your patients, which is lifestyle modification. We need to be helping our patients to learn how to eat well and exercise appropriately. Not only that, but we can even monitor that and be able to provide both the encouragement and the accountability it takes to reach those health goals. So what does having a vested interest in the outcomes of your patients actually look and feel like? Well, it manifests itself in 2 specific ways. The first is a strong adherence program. You and I have heard about this over the past several years, but this has to become a new way of life in the DNA of the pharmacy, where it's no longer a separate workflow, but this is a new norm for you and your workflow. Whereas a patient living with a chronic disease such as diabetes will be in your medication adherence program. You can use a variety of technologies, you can even use pen and paper, but the fact remains is that this is the new standard of care and therapy within the community pharmacy. And so no longer should you have some sort of separate workflow that says, here's our adherence program where we have 20 people enrolled so far, and here's our normal workflow where we do other patients. That all has to mend together. So you as a pharmacist can make an incredible difference in the lives of your patients when it comes to adherence. Now, that's just one piece of the bigger pie of the outcome, but still, adherence can make an incredible difference, and you need to identify those barriers that are going to keep them from taking their medicine. And it's not always because I forgot to take the medicine. It could also be because they're experiencing a side effect and it makes them not want to take that medicine, or they would experience that side effect again. It could be another, such as cost. Whatever it may be, we need to make sure that we identify that, and you as the community pharmacist has the responsibility of doing so. But beyond adherence, we want to also have a vested interest in the outcomes of our patients. And in order to do that, we have to be able to judge success. Because again, as we mentioned beforehand, we want to have the right drug at the right time for the right patient. And so therefore, we need to make sure that you are having those specific measures that can judge whether or not a drug is working appropriately. And so you as a pharmacist can ask your patients for fasting blood sugars, for blood pressures, for whatever it may be. And also, in order to do so, we're going to be able to connect with and must connect with healthcare professionals who have labs and other data that can help support that. So as chronic diseases are making an impact here in the US and are in an assault with our families and children, you and I play a key role in being able to make sure that we have positive outcomes by having a vested interest in those outcomes. There are many different avenues or channels that you can utilize your role as the clinical community pharmacist beyond the dispensing role, which is a huge and vital role for you. But there are other areas as well, such as transitions of care, partnering with a hospital to provide hospital discharge planning. Diabetes self-management education, where you are actually connecting on an intensive way with your patients and billing for it. Also, weight loss management, asthma and COPD management. Comprehensive immunization reviews are a strong way for you to be able to connect with your patients. Also, heart failure management is a primary way for you to be able to connect with your patients. And then finally, adherence management. We know that adherence is a piece of the bigger pie. We know that whenever we can connect adherence with actual outcomes, we can truly make a difference in the lives of our patients. Diabetes is one of the most prolific chronic diseases we have today. You know, if you look to your left or your right, surrounded by people, one of you has prediabetes, and the studies show, and according to the American Diabetes Association, almost all of them will progress to full diabetes within a few short years unless someone or something intervenes. That can be you, the community pharmacist. And so there are many ways that you can affect your patients living with diabetes. The first is in pre-diabetes counseling. There is a new opportunity for you through the Center for Disease Control, or the CDC, to actually be able to have a recognized program for pre-diabetes care. Much of it is built around the diabetes prevention program, which basically shows that if you can reduce a patient's weight by about 5% or more and sustain that weight loss, that you can drastically reduce the progression of diabetes. The second thing that you can do, and it's built around all that we do, is through education. Maybe that looks like an individual educational approach within the counseling booth of the pharmacy. Maybe it's also a group class, and you say, you know, I don't really have the time to be able to connect one-on-one with patients like I need to, but I've got an hour or so a month that I can give. Then you can automatically have a classroom where you can connect with patients, teaching them the basics of diabetes care. Because within diabetes care, we have 3 specific places that you want to be able to take your patients, and it's the way that we treat. Many times we call that the 3-legged stool approach, and that is diet, exercise, and medicine, and in that order. And you, the community pharmacist, can still play a primary role in those other 2 areas that we call lifestyle modification. You know, that's the first prescription that's ever written for a patient living with diabetes. Hey, I need you to begin a diet plan, and I need you to make sure that you are exercising as well. You can not only help them to learn about the specific ways that they can improve their nutrition and improve exercise, but you can also help hold them to a healthy accountability. It's not just the information that you're giving, it's the encouragement and the accountability that it takes to reach those health goals that you can help your patients. So again, education plays a primary role. You know what? Speaking of education, many of you are ready to begin the next step in diabetes education, where you could actually have an intensive therapy program where you might be able to even bill for diabetes education. NCPA has an incredible program that can assist you with that whenever you are ready. Let's also dive deeply for just a moment into diabetes self-management education. You may see this sometimes written as DSME, sometimes even with T on the end of that. That stands for training. You see, Medicare and most other insurances actually pay for diabetes education. Many community pharmacists feel like they have to become a certified diabetes educator to do that in order to bill, but in fact, that is untrue. Your facility, your pharmacy can actually become accredited by either the American Association of Diabetes Educators or the American Diabetes Association. For more information, check out the diabetes program called the DASPA, D-A-S-P-A, at NCPA. And through that, you can ultimately bill up to 10 hours of education, and there is a pretty strong reimbursement because these are also in-group classes. More than anything, we know that patients living with diabetes are eligible for this service, but unfortunately the majority have not yet been able to take advantage of this service. Think what would happen in your community if you were to provide specific and intensive diabetes training for your patients. What would happen to the makeup of your patients? You know, heart failure and heart disease are another area that you can play a pivotal role in within the community pharmacy. You see, heart failure, for example, is ravaging America. Millions of Americans are living with heart failure every day, and it's also a primary cause for hospital readmissions, which we'll talk about more in just a moment. But how can you as a clinical pharmacist be able to affect heart failure? Well, one of the things that we look at within heart failure is about the medicines. You know, if you're discharged on medications for heart failure, there's typically other comorbidities as well, and many times you're on a minimum of, say, 8, 9 medicines for that. And many times those medicines are in conjunction with other medicines that they might be taking at home, such as herbal medicines, OTCs, and more. You play a key role in that and being able to make sure that they're on the right medicine at the right time. And also, even knowing your New York Heart Association class and other classifications for heart failure makes a big difference as well. For example, knowing the medications will typically give you a feel for which New York Heart Association class a patient may be in heart failure. And because of that and knowing that, you can actually make specific recommendations for exercise because you'll know whether or not they can walk to their mailbox or not, whether they're walking normally to daily activities, whether they're struggling with that even, and more. On top of that, you can even play a key role in monitoring for blood pressure as well as weight gain. As we all know that with diabetes, we're always looking for weight loss typically. In heart failure, however, we're looking at weight gain. And so you can actually have your patients report that into you. Again, being the conduit of change and being able to be that provider that connects with your patients so that you might be able to pass that along to physicians as well, again, as a continuity of care. Another area that you can focus on is in the area of COPD. And again, it can also include asthma as well. Now, COPD, you may think, you know what, this is just something where I just need to give them the medicines and make sure that I'm counseling on them appropriately. And that is a huge part of it. And it also plays perfectly into your adherence program as well. So again, as your patients are coming in on their chronic medications, on their medications that are keeping them from having a breathing attack, we know that that is key to be able to put that into your medication adherence program. But it's also vitally important that you might, as a clinical community pharmacist, be able to also monitor for exacerbations or breathing attacks. We could do the same thing with asthma as well. So maybe some of you could actually go and connect with a pediatrician group and say, if you'll send me your asthma patients, then I will, number one, educate your patients. Number two, put them into a medication adherence program. And number three, we will monitor for those breathing attacks and be able to make sure that we can dose that chronic medication more appropriately. So by knowing your guidelines for COPD, for asthma, for heart failure, for high blood pressure, and more, you can make a difference there, not only to affect adherence measures, but also to go beyond that in being able to affect patient outcomes in incredible ways. You know, another area that pharmacists are making an incredible difference in is in the area of transitions of care. You see, some pharmacists are able to partner with hospitals to provide specific programs, such as a bedside delivery program, where you're simply delivering those medicines to the bedside. But it could also be something greater. Some pharmacies are actually beginning to partner with hospitals in a very deep way, where they're actually rounding with physicians in the morning time and being able to affect the choices of medications that they're on. Ultimately, they're following them over a 30-day period to be able to make sure that we can keep them out of the hospital, but also improve outcomes. And then ultimately, they're assimilating them into programs such as educational programs that they have as well beyond those 30 days. And to be quite honest with you, those hospitals need you, the community pharmacist, because you see, there's no other healthcare professional that's going to be able to connect in the way that you have. Because at the end of the day, if we look at the model that is currently being done, we have at the discharge process and at the bedside, we have the physician there, you have the nursing staff, you have dietitian, social work, all of those people. But none of them will ever see that patient again unless they're readmitted into the hospital. And so if we can interject you, the community pharmacist, into that approach, then all of a sudden we can have a powerful approach as we discharge patients out of the hospital and into the community. Let's talk a little bit more about transitions of care, where hospitals in the community are partnering with you, the clinical community pharmacist, to be able to reduce readmission rates. You see, right now, hospitals are now being penalized up to 3% for heart failure readmissions, pneumonia, myocardial infarction or MI, COPD, as well as hip and knee replacement. You see, if they have readmissions that are higher than the standard, then they are actually penalized. All of their Medicare patients are penalized for those readmission rates. In fact, it's not just the patients that are readmitted that they're being penalized on, it's over the entire year for all Medicare patients. There are several ways that pharmacists are now partnering with hospitals for transitions of care. It can range from the simple bedside delivery, where you are delivering medications to the bedside and beforehand you're determining any prior authorizations that are needed or any other issues that would keep them from actually taking their medicine, and you're removing the barrier of access to medicine. But it can also range from the other side as well, where clinical community pharmacists are rounding with physicians in the hospital or with the transitions of care team, and they are making those determinations of the medications and which ones to take along with the rest of the team. They're following them over a specific 30-day period and doing specific things such as looking for adverse drug events, connecting with them to ensure those medicines are effective as well, and ultimately being able to further improve the readmission rate. We know that on average, when a pharmacist gets involved in transitions of care, the average reduction in the first year is somewhere between 30 and 40%. If you're interested in finding more information about that, check out Project Red. You know, you might be thinking at this point, I'm just not quite so sure about this whole idea of the clinical community pharmacist, because it's just too different from the way that I've practiced medicine and pharmacy in the past. But let me just encourage you, because you can not only improve the lives of your patients surrounding you in your communities, but you also have the power to be able to change your industry. You see, an entire tree is actually contained within this small seed right here. But equally as true is that an entire forest is actually contained within this seed. And with a few small seeds in the hand, we can actually change this entire landscape of pharmacy practice as well as the healthcare industry as a whole. So you see, while diabetes is ravaging America, while obesity is at an all-time epidemic, we have the power to be able to change all of that, because the idea of the clinical community pharmacist gives rise to thoughts and ideas that propel the industry, that improve patient outcomes, and even develop new payment models. So as you begin to impact your community through diabetes education and partnering with them and doing pre-diabetes education programs, doing heart programs, and being able to affect patient outcomes in that way, and COPD, and the list goes on and on. As you begin to do that, you not only affect your community, but it begins to spread to other communities, and that begins to change healthcare as we know it. And at the same time, on the pharmacy side, other pharmacists catch wind of what you are doing in small town America, and all of a sudden they begin to do what you are doing. And so we begin to change our profession so the clinical community pharmacist can have far-reaching effects. And so again, you might be about ready to retire, you might just be coming into the industry, but you are the agent of change. So will you be the seed of the clinical community pharmacist to change both outcomes and our profession?